Hello Medicos. Today topic antimicrobial drug part 2 inhibition of protein synthesis. We already completed part 1. If you didn't watch then go and watch the video. Link in the description. In last of the video I will also give the MCQ related to the this topic. So please watch the video completely. Today topic I will start drug inhibit the protein synthesis. Drug inhibit the protein synthesis. All drugs inhibiting protein synthesis are bacteriostatics in nature except aminoglycosides and the streptogramins. Aminoglycosides and streptogramins are the bactericidal in nature. All are bacteriostatic. Bacteriostatic means which inhibit the growth of the bacteria. Mostly drugs which inhibit the protein synthesis are classified into the two classification, like classification on the basis of drug act on which subunit of ribosome like 50S and 30S, and classification on the basis of the spectrum. Classification on the basis of drug at which subunit of the ribosome like 50S and 30S like chloramphenicol, macrolides, clindamycin, quinipristine, dalpipristine and linezolides. And drug which inhibit the 30S ribosome like tetracycline, aminoglycoside and spectinomycin. Classification on the basis of the spectrum. Classification on the basis of spectrum like narrow spectrum, moderate spectrum and broad spectrum. Narrow spectrum like lincosamide, oxazolidins and the streptogramins. These are the drugs for which act on a narrow spectrum. So we will learn the trick LOS. These are the narrow spectrum antibiotic. Moderate spectrum antibiotic. Moderate spectrum like the ketolines and macrolides. So please learn the trick KEMA. KEMA is the trick for the moderate spectrum antibiotic. And broad spectrum antibiotics like chloramphenicol, aminoglycosides and tetracycline. So please learn the trick CAT. These are the broad spectrum antibiotic. Narrow spectrum antibiotic. Narrow spectrum antibiotic like the lincosamides, oxazolidins and streptogramins. Lincosamide like lincomycin and clindamycin. So please learn the trick lincosamycin and clindamycin like the link LINC link. This is the trick for the lincosamycin and the clindamycin. It bind with the 50S ribosome, where it bind 50S subunit of the ribosome. Clindamycin is the drug of choice for treatment of severe invasive streptococcal infection, in which cases streptococcal infection when it will become severe cases, and it also used in case of the anaerobes infection like bacteroides and the propionibacteriums. It also used for the cocci bacteria, anaerobes and the parasite. So please learn the trick CAP. This is very important. So please learn this CAP. This already asked in the examination. And adverse effect of the lincosamides is the hepatic dysfunction, means hepatotoxicity occur when used in the more amount and for a long time. And oxazolidinons. Oxazolidinons, it is also a narrow spectrum antibiotic, and example of the oxazolidin like the linezolide and tadizolides. So please learn the trick litti. This is the Bihari food. So please learn the trick litti. Linezolides and tadizolide. It also bind with the 50S subunit of the ribosome. It is effective against the MRSA, MRSA and VRSA and vancomycin resistant Enterococcus faecium as well as facially. Please learn this. This is very important. Like first question it asks, when MRSA and VRSA both option are given, then we will choose always the VRSA, because oxazolide best used for in case of the VRSA. And also in this, please remember that faecium and facialis, in both cases we use the oxazolide, but streptogramins are used only in case of the faecium. So please remember this difference. This is very important and already asked in the examination. What is the adverse effect of the oxazolidine? Adverse effects of the oxazolidinones like neutropenia, thrombocytopenia, serotonin dysfunction. Thrombocytopenia means decrease in the platelet count. It is very important. Streptogramins. What is streptogramin? It is also a narrow spectrum antibiotic, and the example of this is the quinipristine and the dalfopristine. This is the example of streptogramins. So please learn the trick Quindle. like you will always know quintal, so trick is the quindal. Please learn this trick. And it also bind with the 50th subunit of the ribosome. The combination of quinipristine and dalfopristine also effective in case of the gram-positive bacteria which has penicillin resistance like pneumococci, methicillin resistant enterococci faecium, not facial, only faecium, and also used as MRSA as well as VRSA. So please remember this. And what is the adverse effect of the streptogramins is the venous irritation and the arthralgia malgia syndrome. Please learn this syndrome because this is important and already asked. So arthralgia malgia syndrome are caused by the streptogramin. In this diagram, I already saw that the oxazolide bind with the which subunit? 50th subunit of ribosome. So please remember this. Now moderate spectrum. Moderate spectrum include ketolites and the macrolides. Ketolites, example of the ketolites included the telithromycin. So please learn the trick kitty. What is like kitty party? Kitty. This is the trick for the ketolites. It also bind with the 50th subunit of the ribosome. And when it is used in case of the respiratory tract infection. Adverse effect of this is also causes the hepatotoxicity. Macrolides are also moderate spectrum of the antibiotics. Example of this is the tacrolimus, clarithromycin, azithromycin, roxithromycin, and erythromycin. So please learn the trick. Take care. What is the trick? Take care. This is the trick for the macrolide. Macrolide also bind with the 50S subunit of the ribosome and it is taken mostly orally and it is used for the anti-inflammatory drug and immunomodulator drug. Please learn this anti-inflammatory and immunomodulator drug because already asked in the examination. It is a drug of choice for the Legionella, atypical pneumonia, whooping cough, Campylobacter and the Corynebacterium. So please also learn this. This example is very important also. Legionella, atypical pneumonia, whooping cough, Campylobacter and the Corynebacterium. Azithromycin and roxithromycin are also used in against the Haemophilus influenza and Neisseria. And also clarithromycin is used against the Mycobacterium avium complex and treatment of the peptic ulcer by the Helicobacter pylori. Spiramycin is a drug of macrolides. It is a drug of choice for treatment of toxoplasmosis in case of the pregnancy. Please learn the in case of the pregnancy when toxoplasmosis infection occur, then we will use spiramycin. This is very important example. Please learn this. Fidaxomicin. It is a drug also called macrolides and used in the case of difficile infection. What is the adverse effect of the macrolide? Adverse effect of the macrolide like diarrhea, hepatotoxicity, ototoxicity, jaundice and anorexia. What is ototoxicity? Ototoxicity is the increase of the pressure in the internal ear due to the increase of the endolymph in the internal ear which causes the increase the pressure into the ear. Mechanism of action of the macrolide. I already said that it binds with the 50S subunit of the ribosome. So it inhibits the protein synthesis. Broad spectrum antibiotic. It included tetracycline, chloramphenicol and the aminoglycoside. I will start now. Tetracycline. Tetracycline drugs divided into the groups. Group 1, Group 2, Group 3 and new types of the drug. Group 1 included the tetracycline, chlorotetracycline, oxytetracycline. Group 2 included the demiclocycline and the lamicycline. Group 3 included the doxycycline and minocycline. And new type of the drug, it is very important like irvacycline, omedacycline and the sarecycline. Please learn this. It is very hard example and compared to the other example. It is a broad spectrum antibiotic and bacteriostatic in nature, means it inhibits the growth of the bacteria. It is taken orally with empty stomach, intravenous and topical form in the eye. Tetracycline cross the placenta and affect the fetus if administered to the pregnant female. So it causes the teratogenicity all tetracycline are excreted primarily in the urine. Please learn this. All tetracycline excreted in the urine except the doxycycline, which excreted mostly in the case of the feces. So we will use doxycycline for the presence of the renal failure. In case of renal failure, we will use doxycycline. Tetracycline used in case of the Lyme disease, rickettsia, mycoplasma, chlamydial infection, relapsing fever, amoebiasis, malaria and cholera. So please learn all the example. It is very important. So please learn all the example. Cholera already asked in the examination. Cholera. Which what is the, in which cases of the disease we use like cholera. Adverse effect of the tetracycline. Adverse effect of the tetracycline include tooth enamel dysplasia, defect in the bone growth like in the children, kidney and liver damage, GIT toxicity, vestibular dysfunction, diabetes insipidus and the photosensitivity. It is the adverse effect of the tetracycline. Mechanism of tetracycline, I already said that it bind with the 30th subunit of the ribosome and then preventing the binding of amino acid tRNA to mRNA ribosomal complex. So it causes the inhibition of the bacterial protein synthesis. Chloramphenicol. Chloramphenicol is the bacteriostatic in nature and wide spectrum drugs. It binds with the 50th subunit of the ribosome. It is a drug of choice for the typhoid fever and also used for the ANOPS. Please learn this, the typhoid fever. It is very important example. What is the adverse effect of the chloramphenicol? Adverse effect of the chloramphenicol causes the allergy, decrease RBC and WBC number and also causes the gray baby syndrome. Gray baby syndrome like characterized by the decreased number of RBC, cyanosis and cardiovascular collapse called gray baby syndrome. Please learn this example. It is very important. It causes the drug toxicity. So very few systemic uses of chloramphenicol. Now I will discuss aminoglycoside. Aminoglycoside is also a wide spectrum of antibiotic, but it is a bactericidal in nature. I already discussed chloramphenicol and tetracycline. It is a bacteriostatics in nature, but aminoglycoside are the bactericidal in nature. Example of aminoglycoside included streptomycin, gentamicin, kanamycin, tobramycin, amikacin, sisomycin, netilmycin, neomycin and the phragmycetin. This is the example of aminoglycoside. Please learn this example because very much, so I didn't make any mnemonics. It binds with the mostly 30S ribosome. Which unit of the ribosome? 30S subunit of the ribosome. Resistance to aminoglycoside drug are drug used formation of inactivating enzyme like phospholipid adylate the drugs except the amikacin and the netilmycin. It isn't resistance with resistance of the bacteria. Streptomycin is the first line drug for treatment of the tuberculosis and amikacin is the second line of drug for tuberculosis. So please learn streptomycin. First line of drug for the tuberculosis is the streptomycin and second line of the drug for the tuberculosis is the amikacin. It is very important. So please learn this. Aminoglycoside also produce the synergistic effect against the gram-positive bacteria when combined with the beta-lactam or vancomycin. What is the adverse effect of the aminoglycoside? Adverse effect of the aminoglycoside like nephrotoxicity, ototoxicity and a neuromuscular blockade. Please learn all the adverse effect of the aminoglycoside because already asked in the examination. And nephrotoxicity is highest by the neomycin and the ototoxicity is highest by the amikacin. Please also learn this both because it's also asked in the examination. Thank you so much. Now we completed second part. So please solve this question related to this part of antibiotic which asked in examination and send your answer in comment section. I will give the answer of this on my Instagram profile. So follow me on Instagram, link in the bio. Thank you so much. If you like, please subscribe and share.